So, I am going to discuss about the bacterial disease that causes the STD. It also cover HIV, it also cover hepatitis B, hepatitis C, it also covers herpes. These are viral diseases. So, this will be discussed in some other class. Today, STD will be that of the bacterial diseases. For your examination purpose, HIV is very important. Urinary tract infection. It's a very common disease. You will find this disease very often in the outdoor, in the hospital. Very common disease. So, first the diagnosis. How do you diagnose it? By urinary culture. কি দেখা হয়? Urinary culture আরে ব্যাকটেরিয়া তো কি একটা ব্যাকটেরিয়া পাওয়া গেলে কি সেটা What do you see from your knowledge of microbiology? আসলটা আছে. What is the colony count? Right? UTI হয়নি? তাহলে 10 to the power of 5 per ml the colony count. সবাই বসে রয়েছে. ঠিক আছে? So that is the surest test of bacterial colonization of the urinary tract. Then the second thing, that is antibiotic sensitivity. A lot of the bacteria that has been causing the UTI has got resistant to numerous antibiotics. So knowing the sensitivity is important. Now this sensitivity test for this sensitivity takes time. So if no sensitivity tests are available, you do some empirical therapy, give some empirical therapy. So the minimum in a culture, the minimum amount of antibiotics that should be present, concentration of antibiotic that should be present to prevent the growth of bacteria. And what is minimum bactericidal concentration? To kill the bacteria. One is to prevent the growth and another is to kill the bacteria. So what are the significance, clinical significance of MIC? Yes, for the purpose of dosing. For a antibiotic to be effective against an organism, the organism should be first of all sensitive to that antibiotic. Then the next thing that comes, that concentration of that antibiotic should be in appropriate amount in that medium. Suppose you want to, let's discuss urinary tract infection. So the bacterial growth is in the urinary tract. So the concentration of this antibiotic should be adequate in the urinary tract. Suppose the antibiotic get metabolized in the liver and does not concentrate properly in the urinary tract, it will be useless. Similarly, if you have some infection in the CSF, that concentration must be adequate in the CSF. Concentration dependent killing. Mana? Yes. So the killing is dependent on the concentration. More the concentration, the better the killing. And time dependent killing, there must be persistent concentration of that antibiotic for a period of time. It requires some time for killing the bacteria. Post antibiotic effect. What do you mean by post antibiotic effect? Post antibiotic effect means even if the antibiotic has been withdrawn, is not present in that media, the effect of that antibiotic will be present. The aminoglycoside, the ciprofloxacin, the fluoroquinolones, they have this post antibiotic effect. So let's suppose aminoglycoside. it binds to the junction of 50S and 30S ribosome. So once it had bind to that junction of the 50S and 30S ribosome, the ability of that bacteria to produce proteins, to synthesize protein is lost. Even when the antibiotic is withdrawn, the effect of the antibiotic will be there. So that is post-antibiotic effect. So most of the UTI are ascending, happens by ascending route. And ascending route means from the urethra. From the urethra, it colonizes the urethra leading to urethritis, then it colonizes the bladder, cystitis, then ureter, then kidney leading to nephritis. If there is pus, that is pyelonephritis. It may require surgical intervention. It may, from the kidney, it may also spread to the blood leading to sepsis. So, it may be by the ascending route. It may be by sepsis, the other way around. Infection is in the blood, from there it goes to the kidney. The commonest one is the ascending route. The colons are loaded with bacteria. Colon and fecal matters are loaded with bacteria. From there you may get the infection. Most common organism, E. coli. Most common organism are common organism to cause UTI is E. coli. The gram-negative bacteria are the most common organism that causes the UTI. There are also some gram-positive bacteria. So other method, catheter-associated UTI. So when you are catheterizing a patient, the patient has been some inherent protecting properties. When patient is catheterized or some procedure is being done in the urinary tract, that protection is lost. That may lead to UTI. Recurrent UTI, who are the people most susceptible for recurrent UTI? Recurrent UTI? Immunocompromised patient and diabetic patient. No, in diabetic patient, the urine contains high concentration of sugar. As you have studied in your microbiology, there are different medias. These media contain sugar. So, urine, static urine with high concentration of sugar is a very good media for growth of bacteria. So, complication in the urethra, there may be stricture. For kidney, there may be pyelonephritis. Most common in adult age group, it is most common in females. Why? Length is short, voiding is less, stasis that lead to growth of bacteria. And for infant, in pediatric age group, it is more common in males. Because urinary tract abnormalities are more common in males. So the causative organism, most of them are, you can see, gram-negative bacteria, E. coli, Klebsiella, Proteus, Enterococcus, Citrobacter, Staphylococcus, Saprophyticus. Most common is E. coli. About 85% is by E. coli. Name some antibiotic effective against gram-negative bacteria. Let's come to the first drug. So, combination of Piperacillin and Tazobactam. Piperacillin is a beta-lactam antibiotic. ठीक है? It's a uridopenicillin, and Tazobactam is a clavulanic acid analog. So, how does clavulanic acid and this beta-lactam antibiotic act? The most common method of resistance is producing beta-lactamase enzyme. So, when there is beta-lactamase enzyme, this clavulanic acid binds to this beta-lactamase enzyme, thereby increasing the effective concentration of the beta-lactam antibiotic, and there will be better action on the bacteria. So, it is active against gram-negative infection. Gram-negative infections means all gram-negative infection. One of the hardest bacteria to contain is the Pseudomonas. So, it is also effective against Pseudomonas. Pseudomonas, Proteus, Klebsiella, Enterobacteriaceae, Bacterioids. Now, half-life is 1 hour. So, what about dosing? It requires frequent dosing. Yes, QDS or TDS are required. So, like any beta-lactam antibiotic, it can produce hypersensitivity reaction. ठीक है? Mechanism of action of beta-lactam antibiotic. Anyone? তাতে কি হয়? So it prevents the synthesis of cell wall. ঠিক আছে? Amoxicillin clavulanic acid said for empirical treatment. Just if the sensitivity is not known, you can use it for empirical treatment. Many of the bacteria have this resistance to amoxicillin clavulanic acid. So, the combination is the same. There is a clavulanic acid and then there is a beta-lactam antibiotic. Gentamicin. Gentamicin is specific for gram-negative bacteria. Gentamicin acts only against gram-negative bacteria. Now, gentamicin has a property of it is present in ionized form. So, what will happen to absorption? It is poorly absorbed orally. ठीक है? Gentamicin is very poorly absorbed orally. So, route of administration IV or IM. ठीक है? Now, it is not metabolized and excreted unchanged in urine. The pharmacokinetic. So, what is the significance? It is present in urine at a concentration that can act against the bacteria. That is what we are searching for, that MIC will be reached in the urine. Half-life 24 hours. So, what will be the dosing? Once in a day. Now, gentamicin exhibit concentration dependent killing. Yes, once a day, high concentration, it can lead to destruction of gram-negative bacteria. It is more effective in gram-negative bacteria. But there are certain adverse effects for gentamicin. First and foremost, it is a nephrotoxic drug. ঠিক আছে, তাহলে what should be the precaution? In renal failure person, dose modification may be required or it may be contraindicated as a whole. ঠিক আছে. Second, it is a ototoxic drug. Ototoxic means hearing loss. ঠিক আছে. There are two types of ototoxicity. I am not going into the details. এই gentamicin পড়ানো হয়নি? পড়ানো হয়েছে তো? ঠিক আছে. So very high concentration may not be suitable for a patient depending on the condition of the patient. ঠিক আছে. So dose dependent killing, post antibiotic effect. ঠিক আছে. Single high dose effective against gram negative bacteria, E. coli, Klebsiella, Enterobacter, Haemophilus influenzae, Pseudomonas, Proteus. Another thing, it crosses placenta. What's the significant? Pregnancy, must be careful in giving pregnant woman. Mechanism of action, হয়নি এগুলো, তাহলে এক মাস বাদে পরীক্ষা তো। So mechanism of action, binds to 50S ribosome, 50S and 30S interface. So what happens? It prevents synthesis of proteins in bacteria. ঠিক আছে. So bactericidal agent. Quinolones. The quinolones that are used, ciprofloxacin, ofloxacin, levofloxacin, norfloxacin. ঠিক আছে. Mechanism of action, anyone? DNA guidance. ঠিক আছে. To prevent DNA guidance. What is the function of DNA guidance? Leads to synthesis of DNA that helps in multiplication of bacteria. So this fluoroquinolones prevents the multiplication of bacteria. ঠিক আছে. DNA guidance and topoisomerase 4. Now these quinolones, most of the quinolones, ciprofloxacin, levofloxacin, are very good, has very good absorption orally. Can be used orally or can be used IV. Achha. It has a property of being concentrated in the urine. So what is its significance? Urinary tract infection is effective because it reaches the MIC. Not only in urine, it concentrates in various part of the body like the lungs. ঠিক আছে. তাহলে কি কোথায় ইউজ করা যাবে? আর টিবি, একদম টিবি, রেসপিরেটরি ট্র্যাক্ট ইনফেকশন। ঠিক আছে. হ্যাঁ, টিবিতে ইউজ করে, ফ্লুরোকুইনোলনস আর ইউজড ইন টিবি, সেকেন্ড লাইন ড্রাগ। ঠিক আছে. So high concentration in urine, MIC is low. So what is the significant? Which is better, MIC low or MIC high? Low. At very low dose we can kill the bacteria. ঠিক আছে. So MIC is low. So bactericidal concentration is close to MIC. Long post antibiotic effect. Even after the antibiotic is withdrawn, the effect is there in the bacteria. Then less active in acidic pH. So which pH is more suitable? Alkaline pH. ঠিক আছে? So how do you acidify urine? By giving something which is acidic, কি? Ascorbic acid, vitamin C. ঠিক আছে? You acidify urine. Alkalization, bicarbonate. ঠিক আছে? Different antibiotic has sensitivity in different pH. So accordingly you need to modify the pH to suit that antibiotic. ঠিক আছে? Fluoroquinolones are effective against all type of bacteria, gram positive and gram negative, but here since we are dealing with gram negative bacteria, the effect against gram negative bacteria is satisfactory. ঠিক আছে? So what is chancroid? বল, hemophilus ducrei. ঠিক আছে? Painful ulcer in the genitalia caused by hemophilus ducrei. It's an STD. ঠিক আছে? This fluoroquinolones are effective against chancroid. Granuloma inguinale কি বল কি করে গ্রানুলোমা ইনগুইনালি? Now fluoroquinolone also have this property of teratogenicity. ঠিক আছে? So what fluoroquinolone cause? It may cause rupture of tendon in adults. ঠিক আছে? It crosses the placenta and may cause abnormality in the fetus. Inhibitor of enzyme. So কি হবে? Drug interaction হবে. ঠিক আছে? So which drug interaction have you studied? Which drug interaction have you studied? এই কি হলো? আগের দিন না তার আগের দিন পড়ালাম থিওফাইলিন and ciprofloxacin. ঠিক আছে? Now induction of enzyme and inhibitor of enzyme are important for short note. Please get it prepared. Co-trimoxazole. So what is fixed dose combination? What is fixed dose combination? বল জোরে বল। যে কোনো টু ড্রাগ কি দেওয়া যায়? Does any two drug can be given as per our wish? So there must be certain benefit for fixed dose combination. Two drugs are combined together in a definite proportion for benefit of the patient. ঠিক আছে? First of all, the two drug combined must produce a super additive effect. What do you mean by super additive effect? A plus B more than A and B used separately. Then the volume of distribution of these two drugs must be similar. Then the half-life of these two drugs must be comparable. ঠিক আছে? Then we give it in a fixed dose combination. So co-trimoxazole is a classical fixed dose combination. Fixed dose combination comes as a short note. Please get it prepared. ঠিক আছে? আচ্ছা, trimethoprim and sulfamethoxazole combined in 1:5. A mechanism of action: these two drugs acts on folate pathway. Folate is required for DNA synthesis. ঠিক আছে? Let's see the PABA, sulfonamide, they prevent dihydrofolate, ঠিক আছে, folate synthase, they prevent dihydrofolate, and trimethoprim, they prevent dihydrofolate reductase, ঠিক আছে. These two are individually bacteriostatic drug, but when combined they become bactericidal, ঠিক আছে. This is the superadditive effect, বুঝলি? So sulfonamide, folate synthase, trimethoprim, dihydrofolate reductase, that is how acts. Now co-trimoxazole is a very old drug. Most bacteria have grown resistant to it. Some of them, like E. coli, what is chlamydia? Hey, chlamydia হয়নি কি? হ্যাঁ, কোথায় কোথায়? It's an STD. আর sir, one of the cause of blindness. পড়ানো হয়নি chlamydia তাহলে? না, pneumocystis joribisi. Now this is an opportunistic organism, ঠিক আছে, it's not a bacteria. Now pneumocystis joribisi is present, attacks in immunocompromised patient, ঠিক আছে, in HIV/AIDS patient. In that case co-trimoxazole is very effective. Resistance is very common. It also produces teratogenicity, uremia in renal failure, ঠিক আছে. So must be careful in in renal failure patient. Nitrofurantoin is also an very old drug, ঠিক আছে. Nitrofurantoin is reduced by some enzyme in the bacteria to produce the some reactive species of nitrofurantoin that acts against the bacteria. That's how nitrofurantoins act. Nitrofurantoin is extensively used for urinary tract infection, ঠিক আছে. So it requires acidic urine for production of this reactive species, then acts against gram-negative bacteria, but there is widespread resistance to the nitrofurantoin, to the bacteria. Acha, good oral absorption, half-life is 30 to 60 minutes. Acha, contraindicated in renal failure, pregnancy, G6PD deficiency. What is this G6PD deficiency cause? Hemolytic anemia, ঠিক আছে. You must be careful in G6PD deficiency. Many of the drug are may cause hemolytic anemia in G6PD deficiency. One of them is nitrofurantoin, ঠিক আছে. Fosfomycin is a relatively new drug, ঠিক আছে. Inactivation of MARA, it's a protein, ঠিক আছে, it's acts on inactivation of MARA. Bioavailability is poor, 40% only. Half-life is 4 to 8 hours. Now fosfomycin is present as sachet, ঠিক আছে, dissolved in water, powder form, dissolved in water and is consumed. দেখানো হয়েছিল ফসফোমাইসিন? না, দেখানো হয়নি. Urinary concentration reaches the bactericidal level, it's highly concentrated in the urine. Then E. coli, Proteus, Enterococcus, Klebsiella, Staphylococcus, these are sensitive to the Fosfomycin. It's a relatively new drug. Resistance has not developed to that extent. Is it? Now, methenamine. So, it's a prodrug. It is reduced to formaldehyde. So, what do you know about the antibactericidal action of formaldehyde? Formaldehyde is a very good bactericidal agent. মাইক্রোতে ফিউমিগেশন সব পড়ায় না, পড়েন তো সবাই চুপচাপ বসে রয়েছে। Formaldehyde acts against bacteria, bactericidal agent. Now, one of the advantages, it does not cause any resistance. Yes, because it does not have, it's a general bactericidal agent, acts against lot of bacteria but does not go any resistance. So, administered with ascorbic acid means vitamin C. So, why it is given to lower the pH of urine. Yes, in acidic urine it is converted to formaldehyde. Then enteric coated tablet. Why? What is the significance of enteric coated tablet? It resists the gastric acid. In acidic medium it will be converted to formaldehyde. So, we have to bypass the stomach and then get absorbed and to act in the urinary system. Gastritis. Why gastritis? Acidic medium, it will be converted into formaldehyde. Maybe some spillover that will lead to gastritis. ঠিক আছে, সবাই এত চুপচাপ কেন, কি হয়েছে? অর্ধেক ক্লাস তো নেই। আচ্ছা, urinary analgesic, phenazopyridine. So, this is a urinary analgesic. What is the signs and symptoms of UTI? Painful micturition. ঠিক আছে, there may be abdominal pain, there may be fever. ঠিক আছে, so this phenazopyridine only acts on the pain. It is for symptomatic treatment. It does not have any bactericidal effect. Fully. So, basically a dye. Symptomatic relief from burning sensation. Prophylaxis of UTI. Some cases we need the prophylaxis. In which case, catheterization or if there is some procedure in the urinary system. Then recurrent cystitis in women of childbearing age. Urinary tract abnormalities. What happens? If there is urinary tract abnormality, there may be this stasis of urine, and any stasis of urine leads to growth of bacteria. Drug useful: Co-trimoxazole, Nitrofurantoin, Norfoxacin, Cephalexin. ঠিক আছে, এই পড়ানো হয়ে গেছে তো, কি জানো, সেফালোস্পোরিন পড়ানো হয়ে গেছে তো। Now we come to the STD. Most common organism of STD? কোথায় পেয়েছিস? Look, nowadays HIV is the most common. ঠিক আছে, before HIV syphilis was one of the most common. Organismটা বলেছে Treponema pallidum. Type of syphilis? হ্যাঁ, প্রাইমারি সিফিলিস, সেকেন্ডারি সিফিলিস, টার্সিয়ারি সিফিলিস। ইউরোসিফিলিস কোথা থেকে পাচ্ছি? নিউরোসিফিলিস আছে, ঠিক আছে, টার্সিয়ারি সিফিলিসে হয়। সো সিফিলিস ইজ আ painless ulcer, the primary one. And there will be bacteremia, and then there will be secondary and tertiary syphilis. ঠিক আছে, gonorrhea, well, caused by Neisseria gonorrhoeae, so gram negative bacteria. ঠিক আছে, so complication of gonorrhea, pus discharge from urethra, এটা কমপ্লিকেশন না, এটা সিমটমস। ঠিক আছে, pus discharge from urethra কমপ্লিকেশন হয়, ঠিক আছে, স্ট্রিকচার হয়, আবার পেরিনিয়াম ক্যান হয়, ঠিক আছে। আচ্ছা, ক্ল্যামাইডিয়া তো বলেছে, ঠিক আছে। গ্রানুলোমা ইনগুইনালি ডোনোভাইনাইটিস, হ্যাঁ, ক্লেপসিয়েলা ডোনোভানি, ঠিক আছে। স্যাংক্রয়েড Haemophilus ducrei, that is a painful ulcer of the genitalia. Then trichomonas vaginitis, organism, না ওটা কি? ব্যাকটেরিয়া? Is it a bacteria? It's a protozoa, ঠিক আছে। Protozoa are sensitive to protozoa sensitive to সবাই ঘুমোচ্ছে, vaginal candidiasis, ঠিক আছে, Candida albicans, it's a vaginal candidiasis is a কি অর্গানিজমটা কি? ফাঙ্গাই, ঠিক আছে। দেমাল চুপচাপ বসে আছিস কেন? সবাই চুপচাপ বসে রয়েছে, কোনো রেসপন্স নেই। সিফিলিস, সো পেইনলেস আলসার, ঠিক আছে। So syphilis is some of the very few organisms that are sensitive to penicillin, still sensitive to penicillin. Use benzathine penicillin, procaine penicillin. Now what may be the problem with penicillin? Allergic reaction, ঠিক আছে, allergic reaction. For that reason, if there is allergic reaction, shift to doxycycline. Doxycycline is class there is, when penicillin acts on the organism, it releases lot of materials, bacterial materials, that may also lead to some reaction known as Zerich-Hersheimer reaction, ঠিক আছে, that occurs during treatment, that can be managed. Gonorrhea, like he has said, purulent discharge from the urethra, ঠিক আছে, gram negative organism. Now most Neisseria species are has developed resistance to this penicillin, ঠিক আছে। Amoxicillin and probenecic acid. So what is probenecic acid? Probenecic acid, it acts on the transporter in the tubules of kidney. Now this penicillin and probenecic acid has the same transporter. Penicillin is eliminated in kidney by active transportation, it is secreted in tubule. Now this probenecic acid compete with the penicillin for the same transporter, thereby preventing the excretion of penicillin. That's how probenecic acid is used. স্পেলিংটা ভুল আছে, ঠিক আছে, প্রোবেনিক অ্যাসিড হয়ে গেছে। অ্যাজিথ্রোমাইসিন, ceftriaxone, cefixime. So what is ceftriaxone and cefixime? Cephalosporin, ঠিক আছে? Then streptomycin, ঠিক আছে? Chlamydia trachomatis, drug of choice is doxycycline, ঠিক আছে? কি অর্গানিজম বললি? অর্গানিজমটা কি? না না মানে ক্লাস অফ অর্গানিজম, হ্যাঁ, প্রোটোজোয়া, সেললেস অর্গানিজম, ঠিক আছে? সরি সেললেস বলছি, মানে ব্যাকটেরিয়া ডাজ নট হ্যাভ দিস ব্যাকটেরিয়াল ওয়াল, ঠিক আছে? সো পেনিসিলিন ডাজ নট হ্যাভ এনি রোল। সো গ্র্যানুলোমা ইনগুইনালি আর ডোনোভেনাইটিস, ঠিক আছে? এটা কি কি করছে? রেড ভেলভেটি আলসার, ব্লিডস রেডিলি, ঠিক আছে? সো ডক্সিসাইক্লিন, azithromycin, erythromycin, ciprofloxacin, ঠিক আছে, are used for treatment. তুই কিছু বলবি নুরুদ্দিন? Chancroid, so Haemophilus ducrei, there is painful ulcer. Medicine used is ceftriaxone, azithromycin, erythromycin, ciprofloxacin and doxycycline, ঠিক আছে? আচ্ছা, Trichomonas vaginalis characteristic by profuse discharge and itching from vagina, often has an obnoxious smell associated with it, ঠিক আছে? So the medicine used is metronidazole, ঠিক আছে? It's a protozoa. metronidazole আর কোথায় ইউজ করা হয়? MBBS, ঠিক আছে? contraindication of metronidazole, disulfiram reaction, ঠিক আছে? Co-trimoxazole suppository may be also used, ঠিক আছে? suppository মানে what do you mean by suppository? হ্যাঁ, রেকটামে কিংবা ভ্যাজাইনায় দেওয়া হয়, ঠিক আছে? So vaginal candidiasis, there will be inflammation of vagina and vulva. There is miconazole কোন হয়েছে? antifungal drug, ঠিক আছে? tablet, suppository. Clotrimazole is another antifungal drug, ঠিক আছে? fluconazole, so oral tablet, ঠিক আছে? So once once a STD is being detected, you go for the contact tracing, so where it has come from, ঠিক আছে? So the partner, so whoever is having these STDs and their partner both are treated for the condition. So there are certain kits produced by NACO. হ্যাঁ, শুনতে পাচ্ছি না। These are kits, ঠিক আছে? combination of drugs, you don't have to arrange for the different drugs, one intake and that is all, ঠিক আছে? for the convenience of the patient. Here you see this kit contains cefixime, metronidazole and doxycycline. For what condition? Lower abdominal pain, ঠিক আছে? These kits are designed so that a broad range of organisms that may lead to this lower abdominal pain. Lower abdominal pain, if suspicious of PID, pelvic inflammatory disease, suspecting some pelvic inflammatory disease. So this contain combination of these three drugs. These three drugs will destroy, will act against a broad range of organisms. Okay? That's how the kits are designed for the convenience of the patient. Then you see genital ulcer non-herpetic syndrome. You see what is there? Doxycycline and azithromycin. Okay? So you see chancroid is being treated by azithromycin, doxycycline. Okay? Another kit, vaginal discharge, secnirazole, fluconazole. So vaginal discharge caused by trichomonas. Okay? So these drugs are which are most effective against this organism that is being used. In addition to this, there is this big topic of HIV. HIV is important for examination purposes. Know the drugs for short note. Then there is this vertical prevention of vertical transmission. Then there is PEP, post-exposure prophylaxis. This comes as short note in microbiology as well as in pharmacology. So get this thing prepared. In addition, other are herpes zoster, antiviral to purano hayni. Herpes zoster and hepatitis B virus, hepatitis B, hepatitis C. These are also counted as in the topic of STDs.